Hi, my name is Aakriti Carrubba, and I'm one of the physicians in the Department of Gynecology at Mayo Clinic, Florida. My primary interests are minimally invasive surgery, treatment of fibroids, and management of endometriosis. I'm speaking to you today from the privacy of my office, so I've taken my mask off for a few minutes in order to deliver this message. As we all know, COVID-19 has impacted our lives in many different ways, including our ability to see a physician face-to-face. Many appointments were canceled or rescheduled in the early days of the pandemic, and non-emergent surgical procedures were completely put on hold by state mandate. This was done to conserve the hospital's supply of personal protective equipment and to decrease risk of exposure to patients and staff. But now we are in a state of new normal. Appointments and surgeries have resumed, but with extra precautions like universal masking, temperature checks, and screening before entry to the hospital and clinic. However, this leaves many patients with the thought, is it safe to see my doctor? Today, I'm going to discuss the recommendations from several prominent societies in the OBGYN world regarding resuming healthcare and elective surgery. At this time, surgery for gynecologic patients is approached on a case-by-case basis. In general, our surgeries are considered to be medically important, and many are performed to improve quality of life for our patients. The American College of Surgeons has created a tiered ranking system for how hospitals should prioritize surgeries. This has been modified into 4 tiers for gynecology. Tier 1 is low acuity surgery, which is non-life-threatening and could be delayed without complication, such as benign ovarian mass or hysterectomy for patients without evidence of anemia. Tier 2 includes intermediate acuity surgeries that are non-life-threatening but have the potential for impacting quality of life. These include endometriosis surgery for patients with pain, symptomatic ovarian cysts, and women with fibroids. Tier 3 are high acuity surgeries that have high potential for impaired quality of life, such as suspicion for uterine cancer, cervical dysplasia treatment, and large fibroids that are compressing the bladder or ureters. Lastly, Tier 4 surgeries are emergencies, such as ruptured ectopic pregnancies, ovarian torsion, or bowel obstruction with perforation. There are many more examples in each of these categories, and ultimately the patient and physician will decide if it's worthwhile proceeding with surgery now or if it could be safely delayed. If you decide that you're ready to schedule surgery, rest assured that our staff is taking all precautions here as well. In addition to masks and screening, all patients will be tested for COVID within 48 hours before their procedure. Patients that test positive will be rescheduled to a later date, unless the procedure is an emergency and cannot wait. In that case, we will perform the surgery with full PPE and perform full decontamination procedures for cleaning afterwards. Family members can wait in the waiting room, but they're not permitted in the preoperative or postoperative holding areas. We make every effort to discharge patients from the recovery room on the same day of surgery, unless there's a medical reason that they need to stay in the hospital overnight. During the actual procedure, we take steps to decrease risk of aerosolization of particles, like using a closed smoke evacuation and suction system during laparoscopy. Thank you for taking the time to listen today. You'll find additional information about COVID-19 safety measures at the Mayo Clinic website, and you can always feel free to contact our office with any questions or concerns.